Opioids do play a role in recovery. Usually they're significant during the first 2 weeks of surgery. It's really important after joint replacement surgery that your pain is controlled. We want you to be an active participant in physical therapy. And so when you're dealing with some pain after the surgery, the opioids typically allow that pain to be diminished and allow you to have a successful recovery with minimal pain. After a period of time, those opioids go away, you continue to work hard, and your pain diminishes as well. Some of the alternatives to opioids that we have are anti-inflammatory medications, Tylenol. Typically, again, after your first 2 weeks of being in the recovery process, you are utilizing alternatives. After that, your pain is diminished to a point where you can use something like a Tylenol or an anti-inflammatory after that initial period of time where you're on the narcotic medication.